Welcome back. Welcome back. Are you ready, Dr. Martin? Welcome back to Muscles and Malpractice, your weekly dose of fitness, health, and everything in between. We're your host, Andrew Bustos.
I'm Dr. Stuart Martin.
Dr. Stuart Martin in the hazy.
Yeah.
I'm pumped, man. I know you're, even though you've been crushing it this weekend, you don't look tired at all. I'm just going to tell you this for our viewers that are just listening to us.
Sometimes it's better than others. I actually do feel surprisingly good right now because I got a solid 3 hours when I was doing a labor shift last night and then didn't get to sit back down again after getting woke up. But sometimes like that 5 hours aggregated over a shift is not as good as just 3 hours straight together. And I
3
know I get a good
hours?
night tonight.
Holy cow. So how many deliveries did you have over the weekend? Can you count them?
Well,
Or what
actually,
do you
so
do? Like
well,
what do
when
you
we do these like labor as like hospital employed shifts, what's kind of interesting with them is that it's a different way of doing your job, right? You're kind of like the man on the deck who takes care of any and all fires that come into the hospital. So you can end up doing gynecologic surgery, you can end up doing deliveries for people, you can end up doing a lot of triage, you get consults in the hospital. And almost always, especially with a kind of population sized city that this is where we're at right now, if it's not one thing, it's another always. So it always kind of seems to be like at least nothing's going to be quiet everywhere. So
Yeah.
last night was just a lot of people needing to be assessed. Let's just put it that way. So I saw a lot of people. I didn't have a lot of deliveries, but there was a lot of intake and assessment and triage, as they say.
So they just call up and like, "Hey, doctor, help me with this. Hey, can you check this? Hey, can you do this?"
Call up or show up, one or the other for sure.
Yes.
Um, you're just the gopher, dude. You're just there to do what you got to do.
The gopher. I like that. I like that.
Truly, it's like a little taste of residency again in some ways, for sure.
Yeah. I
Um,
love it. Well, you
and
look good. You look good. You look like
thank you,
you
thank
really
you.
do. I mean, I'd be like this on the video. You can see my face. I'll be like,
Yes. I
I
do
still don't get how
worry.
I don't get how doctors do it, but they do it. They do it.
I think some fields get a little bit more grace in terms of looking pretty haphazard at times in the hospital because it's kind of like, oh, trauma surgeon. All right, he can have his shirt untucked here and there. Or she's an OB. She has no time to take care of herself. Like it is kind of funny that way.
Yes, sir.
Um, so in the periods of lulls and slowness over the last 24 to 36 hours, I tried to kind of find us some good little uh, points of emphasis and kind of like their own little topics and little clarification things I found in the time I've done this that I say to patients over and over and over again that are not like strictly nutrition and a huge topic and subject in nutrition and pregnancy, but kind of come up literally 5 times a day, if not more. And I just feel like there's some good teaching points in here to kind of like go through. They are so unrelated to each other in some ways, and we don't even have to hit them all. But I kind of figured we'd like just start with kind of talking about these things if that was how you wanted to play it. I mean, I did get in trouble in my call room last night too because I was on the phone as we were watching the U of H game, which you brought up last week.
Houston.
And I could not help but scream and slap the mattress when I was in my call
I
room
was too. I was pretty pumped
because
too.
that was insane.
That was a good
And
game.
I got a nice little reminder knock from my neonatal nurse practitioner dorm mate in the call suite area that, hey, people are sleeping here. But
Man, you
I
got in
wasn't at the
trouble. I
time.
like it.
That was amazing. But back to the things we saw that were not basketball related that I thought would kind of be good things to go over this week. I thought actually a first thing that could kind of help illuminate a lot of questions and kind of how patients should approach pregnancy in a more common sense manner sometimes than being so scared of everything and needing to ask your doctor for every little thing you can eat or not eat, or what should you do, is to kind of break it down to its most simple level, right? And so with nausea, which two-thirds of women experience at some point in their pregnancy, even in its mildest form, you're really a lot of times wanting to see what is the minimal amount that you have to do to help get those symptoms to go away. That's not like taking a medication or kind of not being able to go out and do what you want to do. So if we're trying to minimize fetal exposure to medications and we're also trying to make sure the nausea goes away, what are some things that like you can do without even taking anything? Not ginger, not peppermint, not all these things people always recommend to you. What are things you can do, like just about how you eat? And so one thing I do kind of want to emphasize is some behavioral modifications. So never letting your stomach get completely empty. So you actually, when you're nauseous, you should be eating small snacks every 1 to 2 hours. Ideally, you eat right when you get up. Actually, I know people feel like they get morning sickness, but the ideal thing to do is kind of keep your stomach a little bit full. The interesting thing about that too is that you want to try to separate out solid foods from fluids as well. So it's going to be like deconstructing everything about how you eat when nausea is a big problem in your life. If you are somebody who does get nauseous when you eat first thing in the morning, guess what I would tell you to do first? Maybe not do that then. Even though I am sitting here telling you right now you should eat frequently throughout the day, if there's one time you notice that you do get most nauseous, try not eating them to see if that helps. It's a common sense thing that you have to understand that everybody's different, every pregnancy is different. It's one of the most universal rules in this world. And so I think that's kind of like always something we should remember when we're dealing with a pregnancy and when we're kind of like feeling a little overwhelmed with why am I feeling this way and why can't my pregnancy be like Susie's. Another tip,
I was feeling, it's funny as you were saying that. I'm gonna interject here when you said, when you get up and you're hungry. I'm like, man, I'm hungry all the time when I get up. But I know we're talking about pregnant women.
yeah, we're talking about pregnant girl,
We're
man. No,
talking
I'm
about
the
me.
only one
I
that
was
gets up
like,
in my house and walks around and like looking for where the Twizzlers I left somewhere were
"Where's the
at.
food, man? I'm hungry.
Yeah, dude.
I need to eat something." So
It's the worst type of thing you can do too. You know that as well as I do. We're not gonna get into that quite yet, but like when you eat that late night stuff, that is terrible in terms of actually how your body processes
So
it.
do you have so whenever just so I can understand a little bit more, just
Mhm.
because I'm not one of your patients, but do women come to you and they say, like, right off the bat, are most of them like, are they sick? Do they do all of them? Like, have you ever met anybody that is like, man, I love it. Pregnancy
Oh,
is
dude,
awesome.
those patients, I tell those patients not to talk about how great their pregnancy is, honestly, because it really does. They don't even realize how much that irritates their fellow, compatriot pregnant women. So I'm like, I literally, usually when patients are starting to have a pregnancy like that, about halfway through, I'll tell them like, you're really being like, you're having one of those dream pregnancies, or you're one of those people who always have like do yourself and me a favor and don't tell people about how this is going for you because that's just not the
Don't share your
norm and it's
thoughts. No thought
very
sharing with your
irritating.
friends.
Yeah, this is not the normal experience, right?
Yeah.
I do think too, like that's another kind of example, though, exactly why you just can't take every rule and everything we kind of tell patients in a room, even let alone on a podcast. Like I'm trying to do the best evidence-based and researched methodology stuff to give recommendations on. But at the end of the day, you're not that study. And
Sorry, you're not. Okay.
you are not.
You are
You
not the
are the
study.
weakest link, I guess. But it always boils down to just like knowing the real black and white rules. And besides that, really trying to find how to adjust accordingly to get the things you need done. For every person that has these swimmingly smooth pregnancies, there can be people trying to do everything right, like listen to everything I say, and they're just struggling through it. And I feel absolutely awful for them because it feels like pregnancy sometimes doesn't come with a disclaimer when you're going to have a real not fun time the
Mm.
entire 9 months. However, it's kind of one of those games of a roulette in terms of getting a pregnancy one way or the other, if you get what I'm saying there,
Yeah,
because
yeah, yeah.
I will say it's like the ladies sometimes that are sitting there eating CC's pizza and wondering why they get mildly nauseous or something, and they're like, can I have something to treat that nausea? I'm like, maybe don't eat hot, greasy dairy from a cheap pizza place, which is one of my favorite cheap pizza places.
Yeah, yeah, yeah. Because I know you're going over some notes. You have some notes there that you're looking at.
Yeah.
So you're coming up with like what I was thinking of as you were talking, especially with you have such a range, and nutrition is such a it really is a sensitive area. I guess even in my area of expertise when it comes to personal training, anytime you talk about nutrition, you deal with people that are vegan, you deal with people that are vegetarians, you deal with people that are only eat meat.
Hmm.
Like everybody
Hmm.
gets really sensitive. So do you feel like it's easier to just pinpoint and say your food choices matter more? So the things that you're eating matter more than what you think. So making sure that, hey, here really is this guideline, because
Yeah.
I always feel
Yeah. I
like I
mean,
have a hard time with nutrition when it comes to teaching nutrition, because
look,
you can't even say one thing and then everybody gets their feelings hurt. It's like, how dare you say I eat 100
what?
grams of this, or how dare you say I
Like, I think that's
what?
where we need better. It is, and it goes into a point that I think has been hijacked by some people who preach misinformation online about how we should move away from medications and you can cure cancer with, a
Yeah.
holistic, especially the idea of organic somehow being like the way we literally would live to 1,000 years old. We had organic. It was called like pre-Renaissance era. Everything was organic. Like
Right. Well, that's a good point, Dr. Martin. That's a good point.
but again, it's just about common sense at first, getting good sourced information from places, and being a little more analytical and common sense about the things you're putting in your body and the effects those things are having. They're subtle. They're not like medications, but when you start taking things like magnesium for a long period of
Yeah.
time, you do start to notice subtle changes in things. Um, our world is very geared towards immediate gratification nowadays, and um, it's just harder to want to take a step back, slow down, and realize like, what is this thing that I'm putting in my mouth doing to me? How is it making me feel? Why am like, there is just so much information on poor dietary choices and even mental health. Um, but yeah,
Yeah.
like
Yeah.
even what you're saying right now. So like, just like, hopefully we can try to get through one point today of like just behavior modification.
Right.
A
Right. Because
vegan can follow what I'm saying here right now. So the next thing I would tell you is avoid spicy, greasy, strong smelling foods. You can be a vegan in that recommendation right there too. Here's another one. Cold foods are often easier to tolerate than hot. Did you know that?
well,
So
yes, but I do love my food spicy. So, or even you're talking just
okay,
fire. You're talking
but
fire.
again, you're separating yourself from a pregnant lady, because when I hear a pregnant lady go, "Oh, but I just love my food spice," I'm like, "Well, I'm sorry, you made the executive decision to now be pregnant at this point, so we're gonna have to
Yeah.
like put that on pause for a while, because it's just one or the other." It's kind of like, okay, I like spicy food, but I hate it making me nauseous. I don't know what to tell you anymore. Like,
That's what I'm saying. That's why I'm saying, like we were talking about earlier in the green room. I like saying green room, but we
yeah.
were talking about, nutrition, and like I wanted to bring that point up in that
Mm.
it is difficult to talk about it because, like you just said, girl, what are you doing? You got
Mhm.
pregnant. There is no more spice in your life. The Spice Girls
Mhm.
got to go. No more spicy stuff. That's what
Oh,
I said it. I'm not even the doctor. I said
no
it.
more
So listen
spice
to
in
me,
the
girl.
life,
You can't have
dude.
no more spicy until 9 months. How many? What is it? 9 months? 8 months? I don't
There's
even know.
other ways to get spice in your life, Andrew.
Yes, true. But you were talking about earlier about organic. So I was watching on social media the other day, and I was watching an Instagram, and there's this coach, nutrition coach, and he's talking about how like organic versus processed foods, and how everybody's like, oh, you got to eat organic only, and organic this and organic that. And you're thinking like, dude, you don't even, none of us really truly eat organically because we're not. Unless you're the
No.
farmer Joe or Jan down the
Unless you're
road.
growing your stuff in your backyard garden, you can't even like there are FDA guidelines on what qualifies and defines as organic when you buy it from places like a grocery store.
But
You are having an
even that,
organic
yeah.
tomato right next to something else on your plate that probably is contaminated with microplastics.
Right.
So it is just we share this world, we share this food. You can go even to the idea of from dust we came and to dust we become, right? Like
But
we
even things that are
share DNA and parts of our molecules with people that have been dead for 1,000
yeah,
years
you
now
did
on the
mention
planet.
that the other day, and I thought that was crazy. But, that makes sense. It makes sense, though. It
Yeah,
makes sense because even like
yeah.
processed foods, if we think about life as a whole, if we
Mm-hmm.
look back, people didn't live as long, right? People are living longer now
Mm-hmm.
because of processed foods. Like everything that we eat is pretty much processed. Everything.
Yeah.
Different cultures around the world are getting processed rice. They're that is helping them with they're putting all these little nutrients into this rice and they're
Yeah.
eating the rice. So I
No, I
don't know.
mean it is there are both benefits and drawbacks to becoming a first world kind of society like
Yeah.
America is, right? So like that even goes into diet actually because you don't see people and pregnant women in the US worrying about goiter and
Right.
iodine
Right.
deficiency because we have fortified salt and all of our food has more than enough iodine in it.
See?
And you basically have these things like fluoride in your water. That was one of the best things that we've ever done is put fluoride in our drinking water, even though now that's something that obviously a little bit of the and me, okay, like I
I
love a
don't.
good
I
conspiracy
don't.
theory as much as the next guy, but the tinfoil hat crowd loves the fluoride in the water is making you cross-eyed or whatever else. But
Hello.
at the end of the day, there's a lot of good things that have come out of scientific developments and modern medicine and good evidence-based kind of recommendations and understanding of what our bodies need to ensure people get those things in their diet. So you actually see with America versus a lot of second and third world countries, you don't see the kind of nutrient deficiencies and issues in pregnancy here that you would in other places. Women don't have babies that get born and have rickets a lot because we don't have vitamin D deficiency issues like you can find in other places in the world.
Yeah, I just thought that was interesting when you said that earlier. It popped in my mind, but I don't want to throw you off your game because you were talking about hot versus cold,
Well, okay,
and
so going
you know,
going into hot versus cold. So we're talking about you basically you want to have a bowl of cereal versus that bowl of ramen, right? So if you think of it as those two as examples, right? Getting back to though into the idea of separating fluid from solid too. If you drink your fluids separately from your meals, it's going to help you avoid feeling overly full. And that's kind of like one of the themes of this whole thing is you want to avoid triggers. You want to stay slightly non-empty, but you never want to overly fill your stomach because that's a trigger in and of itself. So, guess which type of fluids work best? Hot or
are you
cold?
talking fluids like in
Hot or
a?
cold?
Are you talking like with some salt water, or what are you talking about here?
Who's
Like a
drinking salt water, Andrew? I'm
like
talking about what you
Gatorade?
drink
Or are
when you
you
put it in
talking
your mouth.
what works better?
What works better? What kind of fluids?
So what tastes better? What works better for
No,
the
in terms of
baby?
like
For
being
the
able to tolerate for nausea, it's cold, clear, and sour fluids. So lemon water, ginger ale. You know why people always suggest
yeah, I've heard
ginger
that one,
ale?
the ginger ale.
All right. The other thing is women in that pregnancy nose is like legit. So there are some environmental triggers that can always trigger some nausea and kind of like that wave of nausea that can hit you, especially in pregnancy out of nowhere. Strong odors, heat, stuffy rooms, and motion. There's even some suggestion that like switching your toothpaste or brushing after meals can help. They even suggest like trying to rinse out your mouth or kind of like almost do like a spittoon thing, like where you're kind of regularly kind of like after eating or anything, kind of like doing Listerine and spitting that, so you kind of cleanse your mouth of any kind of taste or just sensation. Again, we can go back into the more like common things, like ginger is always a good idea too. That does have some evidence to say that it actually helps treat nausea, interestingly, but not vomiting in randomized control trials. One thing I will say that's out there that people keep pushing lately as a medical device, and I always tell you guys I like to talk about medical devices and things that get pushed. Acupressure bands are a bunch of hot garbage. If you like them,
Hot
great.
garbage.
But I do like acupuncture, and there's mixed data on that. There's basically nothing to say it does work.
But
But
why?
out of the
Hold on,
Eastern medicine world,
I'm
I
gonna cut you
love
off real quick.
acupuncture, man.
I'm gonna cut you off. What do you mean? What do you mean hot garbage? What does that mean?
I mean,
Come on, tell me. Give it to me.
I wish I just came up with something like crystals. I might be ostracizing a person in that crowd now at this point, but like it's a bunch of malarkey. It's kind of like the freaking like exercise belt thing that goes like this to make you get in shape, right? Like
Yeah, to
it's
help
too
you with
good to
your
be
belly.
true. You wear a freaking thing on it's like magnets. I mean, I don't want to make too many people feel bad about the choices they made in medical devices, but look, we all made
I'll do
mistakes.
it
We've
then.
all been
I'll do
suckers
it. I'll
before.
do it. I can do it. I'm gonna make them feel bad. Why'd they choose
But
it?
understand that medical device industry is billions and billions of dollars over industry because people are desperate for cures that work without medications and doctors having to see them. And that rule of if it sounds too good to be true, it probably is usually a pretty good one to stand by until you can talk to somebody who you feel like you can trust that's an expert in the field. You just said, I think you were just about to say you're such a cocky. Oh, kind. I always try to find where somebody's perspective is coming from. Like several of my patients know, I'll also be more than happy to say that just that way in a joking way. Usually I do that with younger patients because I feel like I get to have a little bit more of a dad voice for them. But I do think everybody should be allowed to. I think when you can start to listen to people and understand their logic, you still don't have to agree with them. I mean, medicine's actually a very pure thing in that way because my job is just to educate, counsel, and advise, even though that sounds almost more like a lawyer, like both my parents were. My advising becomes much more stern as a decision I feel like might be jeopardizing themselves if I feel like that's not the right choice, right? Or if I feel like their understanding is going to put them in risk. If they want to go get acupuncture and there's no data to say it helps, there's also nothing to say it's unsafe at all in pregnancy. And there is data with acupuncture regarding certain conditions outside of pregnancy and pain relief. And so I'm a big believer and advocate for things outside of traditional allopathic medicine that help. I love that. I mean, again, my family has a big history of ovarian cancer. There's great data with acupuncture and chemotherapy related nausea, as well as certain pain with cancer patients. So there is things to take away from alternative medicine. I just think you have to know, where those safety kind of guardrails are. Just because, again, I always try to like really, really, really emphasize to people, like, I know there's sometimes a misconception of maybe the way doctors can be and are, and there may be bad actors in the field, just like everything. But like, we do this because we love doing it. I mean, I'll tell you right now, I don't like spending 24 hours on Saturday into Sunday watching the U of H game in a call room that's as big as a broom closet because it's fun for me and I wouldn't rather be at home. I bet it is great to just like take care of people, impact people's lives that way. Yeah.
So
OB is one of those fields. It's a
yeah.
labor of love, dude.
No, I get it. I get what you're saying. It's love. It's tough love. It's all types of loving your patients and loving what you're doing. I do like that. I'll let you catch back up to what you're doing. But I have a question though as you're looking at that.
Uh-huh.
I guess we're talking about hot, cold, different types of food. Is there like are you going to hit on some guidelines when it comes to protein and different things? Because I feel like that's something that's a big one too. When I, you're like, hold it, don't you ruin it for me. But
Well, so we can start touching on that today because remember I
okay,
told you I want to make like the nutrition episode like the diet about the diet episode because you're gonna tell us that what are one of those like take home meal things, man. You're gonna send us a blue apron. It's gonna be
shoot,
Blue Andrew is gonna show
Blue
us
Andrew, yeah,
is going to give
that's
us
cool.
some meal ideas for pregnant ladies in terms of macros and calories. I
Yeah.
have some tables and ideal recommendations in terms of calorie intake, all that. Yes, a hard and fast rule for protein intake. And that's probably the most important one to know for pregnancy and for lactation is 71 milligrams, or 71 grams of protein a day minimum, which is
Okay,
actually more than a non-pregnant, breastfeeding woman is about 46 or so on average.
dude, that's too
Um,
low. That's
it
way
is
too
too,
low.
but that's to keep you like that's what is required to
Yeah,
run your body right. You know what I
I
mean?
know what you're saying,
We're
doctor.
not
I get
talking
it.
about like this. Let's get freaking CrossFit,
Let-
baby.
Let's get jacked, baby.
That is what most women require in terms of their body needing to be at optimum operating efficiency.
I like how you
Okay.
talk like a machine because women are machines.
No, no.
Watch what you're saying, Dr.
You
Martin.
watch that. Okay. Really last things on just talking to people about ideal things you can try at home because we always end up getting into this. It is the first medicine we use in OBGYN for nausea and vomiting and pregnancy. The trade names for these meds are things like diclegis, Bongesta. What's crazy about it is that it's a two-part medicine. It's doxylamine, which is an antihistamine, as well as pyridoxine, which is vitamin B6. Those are both over-the-counter things. Unfortunately, for whatever reason, the way these companies were able to design this dual-acting med, they patented it in a way that women try to get these prescriptions filled for these meds that have to be prescribed and they somehow cost more than any hundreds of dollars for a medicine that is made of things on the Kroger grocery shelf. Always try this at first before you even come into CNOB because you're probably, I mean, you can pay for the fancy stuff. God knows I would try to do everything to make my wife comfortable I could in her pregnancy and get her the best medicine there is, but it's expensive. And honestly, you can get vitamin B6. You take 10 to 25 milligrams every 6 to 8 hours, and that's where you start. And if you need to honestly add doxylamine, that's found in Unisom. You just need to look at the back and make sure it's not. Unisom labels themselves sometimes between doxylamine and diphenhydramine. You just need to make sure the active ingredient says doxylamine. And you can take that at one tab every time you're taking that pyridoxine, that vitamin. It's one of the most effective nausea treatments we have. It's actually first line over stronger prescription medications.
Let
Okay.
me ask you this, doctor. Let me ask you this.
Yeah.
So if my dad, and this is how maybe you can correct me with this, but what I just got from what you just said, it's almost similar to when my dad, I remember he was like, "Hey man, do you need some ibuprofen?" And I said, "Yeah, I'll take some ibuprofen." And he brought me a pack, and I know you're not supposed to do this, but it was a prescribed ibuprofen. Okay, and it was like 600 milligram tab. I said,
Oh, not the
"Someone's
800, not the horse
800, but
pill, dude. That's the one I like to give my
but
patients.
someone prescribed that. Can't you just get? I mean, you just go and take 4 of them, or four little tab, or is that what you're talking about? Like you're like,
I'm
oh well,
talking
you can
about, yeah, you go to a pharmacist and say, hey, where is the pyridoxine in your pharmacy area? And it's somewhere on a shelf. And then there's also Unisom somewhere on a shelf. And then you make your own at home. This has been happening all across the country for close to 5, maybe going on 10 years now because people and doctors are so frustrated with this particular situation where it's over the counter ingredients that this company have somehow been able to create a price issue where it is hundreds of dollars usually. So most people, it is the first line, bar none, for nausea and vomiting. It's the most effective, it's the most safe, but it's hard to access. Like,
Oh,
why is it a medicine that you can find over the counter that expensive and hard to get a hold of versus medicines patients can't, but that I have to prescribe and are actually harsher on them, like make them either freaking not even be able to stay awake at work or have this very questionable safety issue in the first trimester that I don't want them to have any anxiety over. I know is safe, but they start hearing from their friends, "Oh, Zofran, you shouldn't take that in the first trimester. Or I've heard there's bad things." It's not true, but people in pregnancy, that anxiety is just next level, and I understand it completely.
is that like with first kid to fourth kid, or is that just? Do you notice that with patients that are just coming in that are, hey, this is my first baby, and I'm nervous as I'll get out, or I'm 40 years old and I'm having my first baby. Like, do you
Yeah, I
feel
mean,
like
I
that's
think
a big
first
deal?
baby is definitely, it's just like the jokes about, everything you do for your first baby once they're born, right? You buy like the name brand diapers or whatever, whereas eventually you're like, I think I'll just throw this old t-shirt around their hips and everything. It's like it just starts to become a comfort thing in some levels. But I mean, I would say in general, like I think there's always going to be an anxiety to a situation that there's just so much emotion and energy invested into. And I am not somebody that typically is super. I mean, you're hearing it now. I don't need to eat all organic, and I don't believe that's really like necessary. So I used to kind of believe too, like, okay, why would my dog's barking? I think they.
I'm like
I'm
listening to my
sorry that
mic.
that's in the background. What I would say is I used to kind of not have as good an understanding, I think, of why patients wouldn't necessarily take Tylenol in pregnancy when they'd have a headache. And once my wife was pregnant, even though I'm not pregnant, it's not bothering me, I saw her kind of doing that stuff too. I mean, I have a lot of respect for it. I don't think I'm that strong, but I understand it a little bit better. It's kind of like if I can find a way to get through this without taking it, especially because Tylenol sucks so bad for pain relief, maybe I'm just not going to take it. Like, why even put that in my body, even if it's a category A, completely proven safe medication in pregnancy, if there's something I can do that might avoid even having to take it? Because Tylenol is not great for your liver. I mean, if you took Tylenol twice a day for 10 years versus someone who didn't at all, promise you that that had more taxation on your liver overall than the person who didn't, right? Like it causes your body to have to adjust and address it and metabolize it. So I get it. And it's like it puts your anxieties and your fears and your kind of mental pathos almost on overdrive. Because
Yeah,
me and
yeah, yeah.
my wife are an OB and a NICU nurse. And again, I think we were like just absolutely petrified of like everything up until he was born, our son. And like, especially for me, I always said that. I was like, okay, now that he's born, like, now I really am going to rely on you. And I think she got more nervous once he was born because I feel like our knowledge is actually sometimes our worst enemy because we just sit there paranoid about all the bad things that can happen.
From you're talking
Um,
about all your experiences and everything that you've seen and everything you've heard, or are you talking more about like your job, like what you do, like being a parent kind of changes that. Like, what do you?
I think it's both.
It's
I
both. Okay.
mean, I think being a father actually gave me a much better insight into sometimes patients that I had a harder time necessarily getting on the level of why logic didn't always matter. Why the scientific method was not going to convince them that this was
Gotcha.
what they wanted to do, right?
Yeah.
Um, Which, yeah, I mean, I think once I've become a dad, though, like I do just a very important thing to me that I think a lot of my patients have always appreciated is that I always try to remove my own perspective from what my interaction with the patients are. And remember that for the 20th delivery I've just done, it's their first, second, or third kid
Oh,
of
that's
their
awesome.
life.
Yeah. That's pretty
It's
cool.
like you are doing something in their life that like is gonna be one of those 7-minute moments when your brain is shutting down at the end, right? Um, and that's really like it's an honor and it's pretty cool. And um, so I just try to again remember perspective, I guess, on everything about that.
I
That
like
helps.
that.
But yeah.
I love that.
Okay, well, you're
I'm
getting
gonna.
way too deep with me right now, man.
No,
This
I
is
think it's
getting
good.
too
I think it's
heavy,
good because
bro.
no, I think it's good because listeners need to know like you really do care about your patients, and I was curious. I was curious about that because I think a lot of times it is once you have your second kid, and you're gonna know when you have your second kid that you're gonna be a little bit more
I
relaxed.
think you're
Like you won't be
busting
as
me, dude. You're like telling people we're trying to have a second kid, dude.
well.
Don't
I'm just saying,
happen.
like it's inevitable. I think, right? Is it not? I mean, I guess you haven't said that you're
Yeah.
done.
No.
So it's just I don't know. I'm guessing. I'm throwing a guesstimate out there.
Yeah.
And you even I'm just saying I don't know the truth, but
No. I was an only child. You know this well. I think that was a very interesting upbringing for me, and I had always kind of had a very lone wolf mentality about. I love doing what I do because my mom's life and her ovarian cancer like really influenced me into doing this. But I was never really worried about, when it's time for me to check. Doctors have the most odd relationship with life and death. We experience so much of it and are around it so often that, like, our relationship with that concept is a very unique one. And so for me, I was always kind of like, it's part of the biology of it all. Now, I think about every day how I can make sure that I'll wake up tomorrow so that I don't leave Sam any longer than I have to.
yeah, your
Which is a
son. Yeah,
really
yeah.
weird thing to me. It's like I really don't live for myself anymore. I live more because I just don't want him to not have me there if he needs me.
Man,
Um,
that's nice. I like that.
yeah, well,
Yeah, it's a
that's
good
what you
dad
should
right
think of
there.
as a doctor too, right? You're trying to
That's
make sure
true.
people are there.
That's true. That's it. That's exactly right.
Okay, so going
That's the
into
kind
the
of doctor
next
I would want.
perspective,
That's the kind of doctor I would want.
I think that's the majority. I hope people
It
know
better
that.
be. Gosh.
Some of them are a little on the spectrum and make you think that they don't care, but hopefully they do. And I
I'm sure
always
they do.
want. There are people that will make you feel otherwise. I know that.
We'll name them now.
Even
Okay, so Doctor
so.
Doctor Gutierrez Hernandez. I don't know a Doctor Gutierrez. I just said it.
I think it's always pretty obvious. I hope it is, at least to everybody. Most doctors can kind of spot it very quickly in each other if there is that kind of element.
Yeah.
Um, Okay, next thing that's a hot topic in nutrition and nutrients, and something I always recommend to patients that we don't talk enough about: omega-3 fatty acids, or DHA, which I always tell patients get a prenatal vitamin with DHA in it. What these are important for, so there's actually three major categories of like long chain fatty acids. Two of them are DHA and EPA. These are both found in fish. The third one, I believe, is like ALA. And that one is found more in things like walnuts and almonds. And it's important, but you need far less of it. Whereas DHA and EPA are pretty dang critical. And there's some mixed studies, but enough studies supporting and kind of showing evidence for that supplementing and ensuring you get adequate amounts of these omega-3 fatty acids, especially when you're pregnant and when you're breastfeeding, are going to really set your kid off to make sure they're getting the best chance. They're critical for fetal brain and eye development. They basically help, like, they're kind of lipid elements, building blocks. So they kind of help with a lot of the ways that you end up forming brain matter and kind of myelinating that brain matter, or basically making it run like a bullet train in Tokyo. So things in your brain go quickly and synapses fire fast. So, in essence, if you want your baby to be smarter, make sure you take your DHA. And there are supplements for it. Again, prenatal vitamins usually don't give you enough. You need about 200, 300 milligrams a day of DHA during pregnancy. If you're a big dietary person, as opposed to getting things all in little pill form, there is ways to get it in fish, and you just have to be smart about how you do that, right? Because the other side of that coin with fish as a dietary source is what, Andrew? What's the worry we have with fish always?
Mercury poisoning, right?
Boom, dude. Hell yeah. Love that you knew that
I'll
one.
see y'all tomorrow. See you guys later. I won. I won.
You won the Jeopardy tournament, bro.
See ya.
Yes, because it's a hot topic thing anyway, and you always read these weird stories about people having way too much mercury. So it's very variable too. And the thing is that's where people get into trouble, is they don't know how many times a week they should eat fish if they're kind of limited, especially while they're pregnant, or which type of fish are safe to eat. And so one rule of thumb you can always stick by is that if it's a predatory fish, it is super high in mercury. Because what does that fish do? Eats other fish. So it just keeps concentrating and concentrating mercury exposure, right? The best types of fish to eat are salmon, sardines, trout, anchovies, herring. There's a huge list, I believe, on ACOG's website. You can find them online, though, of kind of like just type in like high versus low mercury content fish. Examples of high mercury fish would be shark, swordfish, king mackerel, tilefish. What I find is funny about this is like,
you just said shark. Someone's going to eat some shark out there. Yeah.
No, I was just thinking that. I'm like, I haven't eaten one of the 4 of those things in like forever.
Like, have you eaten shark? I've never had shark. Is it good?
I feel like I've had shark.
Yeah, you were out there. Hey, Dad, let's go out on the boat down there in the Gulf.
Oh, dude, we're not big fishers, but I've been pretty much everywhere in the world. I have had like zebra. I've had a lot of interesting food. Shark, I think I've had.
I like it.
But yeah, I'm not. Would I ever order it anywhere unless forced to eat it? No.
You're down here at the Long John Silver's, huh? Hey, can I get some shark, please? I'd like a little bit of shark. Yeah, right. We're at Seafood Tavern, or what was the other one?
Now you're getting a little mean.
Can I get some shark, please? You guys gonna have me just tuna, huh?
Tuna's bad. So I would say, well, you can eat tuna, but you have to do 2 servings of it a week at most, because tuna, again, the other thing you have to think about is lifespan of the fish. And no one seems to ever understand that tuna is like bigger than your freaking Chevy Suburban, right? Like those fish are massive and live a really long time. So, and then you get it in these cans. Like it's not the ideal way to eat fish. You want fresh, ideally freshwater fish is always a little bit better too, as a general rule. I didn't even bother to look up, and I should have, because no one out in West Texas especially, but just Texas in general, the worst fish in the world is what everybody likes to eat. It's not even seafood. It's freaking lake food. Catfish.
Give me that catfish.
I'll get back to you next week.
Freaking
water
catfish,
pigeons,
baby.
Dude.
Yeah, gross. I love me some catfish. Give me some of that catfish corner, baby. Come on.
Look, I have never been there. I haven't, man. I don't mind catfish, but it's just like, it's also like, I don't mind, I don't know, what's a better example of that too? Like, catfish is just not worth it to me. Like, if I'm going to eat seafood,
go get you some shark then. Hey, can you get Dr. Martin some shark, please, while I have the catfish? He wants the shark. Hey, so how do you get the fish oil? Is it like I just take omega-3. I take a omega-3
so
fish
again,
oil.
That's the way to kind of opt out of all this period, is just to take a supplement. There's even like a plant-based one called algal oil, which is plant-based for those avoiding fish, and you don't even want to have any vegan level exposure to what is in your diet. But yeah, I mean, I think this is really just as a reminder that you can eat fish in pregnancy. You just need to be smart about it. And I guess if you're like a real holistic person, like you don't want to take purely supplement. I know some people believe, and there is a little bit of reason to believe, you can't take all your pills for your diet. I feel like some movies and TV shows have made fun of that, where it's like, they're like, fork and knife there, cutting up their pills to eat their pills. But like, your body doesn't absorb that as well when it is not easily broken down and kind of like homogenized into a good absorbable material. It's true. So,
It is true.
mm.
It is true. Look, the doctor said it's true. So, no, you're right. You're absolutely correct. And I think that's something too is even in my world, they want to supplement everything. I'm like, just go have you some real food. You don't
Right.
have to, protein's great. Adding in protein is fantastic if you're trying to hit a number, but just have the real deal and you'll it's better for your body.
Yeah. Yeah. I mean, I think ultimately a supplement, if that's going to be the way that, again, I don't want people, it's always about what works for you too, right? Like, I feel like
Yes.
we haven't mentioned that a lot. And that's a principle you and me both truly believe in and know is the best way to approach how you're going to have behavior modification, which is like knowing yourself well enough to know what you're going to be able to stick to. And if you're like somebody that, look, it took a lot of convincing to even buy the supplement in the first place and start to take it, and you know that if it's not as easy as taking a pill and sitting on your bathroom counter every day, take that pill. That's 10 times better than not doing anything. Um,
Oh yeah.
I think people like turn life into an effing challenge sometimes. I want to do it the way, the caveman did it or whatever. And I'm like, good for you, I guess. But like, I already have enough
Hey,
difficulties
then
in
go
my
hunt a
life.
shark.
Like,
Go kill a shark then. You need to go hunt that shark.
I mean, to be fair, that's a perfect example because I remember when I was in Africa for a couple months and there was a hunter there who I grew up hunting. I love hunting. I think hunters are actually some of the most, vast majority, are some of the most fierce advocates and defenders of conservation, actually, weirdly. And people don't understand that a lot of times is that hunters tend to have a very good relationship and respect with nature. But this guy in Africa, like, blew my mind. He was out on this elephant reserve because he still hunted too. But he thought unless you didn't use even a compound bow, that you were taking an unfair advantage over the animal you were hunting.
I
And
love
this
it.
was some like
I love it, dude.
Afrikaner guy. So like he was from Germany originally. I'm like, so he was like, you'd have to get within 15 feet of
Yep.
like a Nilgai or
Get your
something to
knife
get.
and your fist. That's all you need. Hey,
Exactly.
you know what? Come
Exactly.
here.
He's not even saying no guns. He's saying no, that compound bow with that friggin' pullback,
That's right,
kind of
dude.
mechanism, that's cheating. I'm like,
I'm not a
okay.
hunter. You're the hunter. I'm not a hunter at all. I maybe have shot like one gun in my life and I'm not it's just I never grew up around it. But
Yeah.
that's how I see it, man. If I see something, I'm like, man, why don't you let's see the real deal. Take that stick that you got that you're making and let's go see you try to take it down. But
I mean,
that's just
I do see their point when you talk about people, you know, taking down these really big, majestic animals from like 2,000 meters out. It's kind of like, I don't even know if that's accurate, the distance I just said, but it is crazy the level with ballistics and scoping now that like, what are we doing? They're factoring the Coriolis effect as they make their shot, like, right, the
they're pushing a
bullet's gonna
button. It's just
spin,
like, all
right?
right, I got him, and there it goes. That's done. Didn't even have to. I
Hey,
just pushed my thumb down
hey
on a
Siri,
button.
help me aim on the head of this elk here.
Exactly. Siri, can you shoot the laser from the
Oh
sky?
shit, my Siri went off. Okay, final topic that we got to touch on a little bit that I feel like always comes up, and man, do women get like OCD about this one, is breastfeeding. So let's kind of like briefly touch on what you really need to think about with breastfeeding that are big, broad stroke topics. Um, I think the first thing to really understand is that milk production, and I usually try to say this at least once on every postpartum mom before they go home, the visit when I see them, is that regularity and frequency of tissue stimulation, basically trying to either pump or have the baby latch, is the biggest factor in terms of causing good milk production and good milk letdown to occur. And understanding that by day 3 or 4, usually with persistent and regular stimulation, you are going to get good production. And you just have to keep the faith in that fact. Because milk production, once it's established too, it is very resilient. And most moms can make basically the milk they are able to produce is always exactly appropriate for the demands that they are put under. So what's funny is that twin moms tend to produce enough milk uniquely for both of their children, right? So they are actually able to biologically make more milk only simply because the stimulation and the need is actually there. So you really have to rely and understand that principle that is going to be one of the main driving forces, if not really like 80-90% of the drive, as long as you're not really stressing your body out. And that's where I kind of get to next is say you're like just one of these hardcore celebrities or A-list people or whatever, and you want to make people think like, how the hell was she ever even pregnant a month ago and she looks like she never was. People think breastfeeding is always kind of a good way to lose weight. um, so it does, in the first 6 months, you do tend to expend about 400 calories more a day just passively by the process by which milk is produced and let down from the breast tissue. So you actually burn 400 more calories. So you end up having a net negative, like exercise would be 400 calories just by regularly breastfeeding. After the first 6 months, I believe it goes down to about 350 calories a day. Interestingly, though, the data is mixed about whether that truly ends up stimulating weight loss in everybody. So, yes, the calorie deficit is there for everybody. It also, though, doesn't necessarily cause you to lose weight without doing anything else. So, some people then want to diet, they want to exercise, they want to do these things on top of breastfeeding. They're worried about, well, is that going to affect my breast milk production? No. Right? So, like, as long as, again, we're not trying to be freaking Apollo Ono from the what Olympics that was. I don't
Wow,
even know
Apollo
where that
Ono.
came to my
That's a
mind.
holy cow, dude. Out of all the athletes in the world, that's the one you
Right?
came up with.
Where did that come from?
Apollo, I guarantee they don't even know who that is, but that's pretty good.
The speed skater, bro.
Oh
I
no,
don't
he
even
was
remember. It's the
pretty awesome.
Japanese
I think
Olympic.
that was like 2004, wasn't it, or 2000?
Yeah.
Was it?
I mean, like
Was it
half my patients
Athens,
now.
Greeth? Athens Greeth. That's what I was sounding when I was saying that.
But severe calorie restriction. So if you go below, if you do a diet that is under 1,500 calories a day or more than 500 off of what you should, you will see some impacts to your milk supply. FYI. So Andrew, just in case you're worried about your milk supply, don't do more than
got that, dude.
500 calorie reduction. Okay.
I got it. I will never.
It is important also to understand that you will always experience a little bit of temporal osteoporosis when you breastfeed. So basically, your bones are always in a process of breaking down and building in your body, men and women. But the way breastfeeding kind of impacts that homeostasis is it actually pushes it more towards breakdown so that you can release these minerals and things and you're in a lower estrogenic state. It's kind of one more way your baby gets a little more leached out of you. It doesn't increase your risk of fracture. You don't need to worry about that fact because the second breastfeeding stops, you have spontaneous resolution of that loss of density. It is helpful, however, to know that because it's related to bones, making sure you're kind of taking a calcium supplement, a vitamin D supplement, and especially weirdly, you like your special populations. I guess you got a bunch of vegetarians in your family. Vitamin B12 is something vegetarians and vegans all the time need to be reminded of that they don't get in their diet usually, which is mainly found in meats. And the rest of us never have to think about because as red-blooded Americans, I think every meal could be a hamburger and eggs and bacon, basically, and B12 would never go deficient there. But vegetarians, very important you get some kind of B12 supplement because it will be lacking in your breast milk, and that's not good for your baby either.
That's a good point. That's a good point.
Well, okay, one last thing to tie it all back up together, bro.
I love it. Tie the loose
Tie
ends.
it, dude.
Tie
How
it
about
up.
that DHA again? Those omega-3 fatty acids.
That's a good one.
Super important for breastfeeding women on the same dose, 200 to 300 milligrams of DHA a day. You could get that from 2 to 3 servings a week of a safe fish serving. You definitely don't want high mercury in your fish while you're breastfeeding too, because it will kind of concentrate in your breast milk and even be worse. But those DHAs are critical while they're breastfeeding too, because up until your baby is 2, their brain is still growing and forming. And I know my neo friends and buddies would definitely be happy and proud to hear me say that, because that is something I think a lot of people don't understand, is that brain maturation takes 2 years from the time your baby is born. So there is still time to positively impact and affect your baby's development. It isn't crazy to be crazy about your dietary habits and what you're trying to do to make sure you're doing everything right for your baby, but sometimes people are more worried about their baby carrier or what their baby's eating from their mush than they are about the stuff they could do for themselves to help their own baby, right? It's always it always boils back down to, I think women in general are by far the stronger and the sex upon which the world is built, and they will always put everything in front of themselves. But if you don't take care of yourself, you are not going to be able to take care of what you love the most. So it's a perfect example of that again.
Amen to that.
Boom.
Boom. Roasted.
And boom goes the dynamite. Okay. I do have one more weird thing. Can we talk about caffeine real quick?
You can talk about
Because
whatever
that's
you
the
want.
last thing. That's the last thing we really need to kind of touch
No,
on.
you need to touch on this because I'm getting
I'm gonna
pregnant right
touch
now.
all over it, dude.
Listening to this,
I'm gonna touch it so much right now. Here we go.
Touch that thing.
I'm gonna touch it. Let's see here. Let's start with, I think we start at the very top. So, caffeine in pregnancy and really caffeine while breastfeeding, not as crazy important, but still kind of the same rule. 200 to 300 milligrams of caffeine a day is as much as you definitely should have hard stop, because below that, there's absolutely no signs that there would be any negative impact. But above that, there definitely is some data to say you could affect your fetus or your newborn. So how many milligrams of caffeine do you think is in, let's squeeze you hard right now.
I bet it's going to
In
be
a
anywhere from
Starbucks
200 to 400.
espresso.
200. 300.
Okay. 150. All right, I'm gonna put it up here now. Here we go. Can we see this okay? It's up on our screen.
Yeah, those who are listening,
I feel like it's all washed
have this,
out, bro.
We have this chart that's up right now and measuring out the coffee and lattes and whatever else. Oh, I think you made it smaller.
Let's zoom in.
There you go. Zoom, zoom, zoom. I like
Oh
that.
gosh, that's way too small. Let's go a little bit smaller. Okay. So yeah, I mean, again, looking at this stuff, I think especially sometimes with tea, people think oh, tea's so healthy. Well, not necessarily. I mean, that Brew Doctor Uplift Yerba Mate, whatever the hell that means, that's already half your entire caffeine content for the day. Again, just most people are not getting coffee brewed. Let's say, well, nobody's drinking instant coffee. Let's just do a drip coffee, Pike Place, my favorite. I think this is the grande, because I tell people this, because that's 310 milligrams of caffeine. You literally, after one Starbucks Pike Place grande drip, you've met your entire quota for the day. You can't drink a Coke. You can't. And here's where we're going to go to the next stuff, because people forget that, just like you say with dieting, they forget the liquids. With caffeine, they forget the solids. Let's see. I think it's on the third one, though, but I'm going to kind of keep going through some of these. Diet Coke, 46. That's good for me, actually.
Diet Coke, dude.
My
so gross.
hypocrisy lives in the diet soda world.
I don't even know, how old are you? I feel like Diet Coke is one of those that my great grandma was like,
well,
hey,
I cycle through them. I kind of I'll have Coke Zero I feel like Coke Zero has to be cold to be good, and then it's so good. Sometimes Diet Coke hits the spot too,
Oh,
man.
I don't know, man.
Yeah, bro. Look, I'm not preaching the right thing in front of a crowd. I'm talking about all these all natural things. I'm having aspartame basically for sweetener.
Yeah, but you're telling people what they shouldn't do when they have a baby.
Yeah. What's weird about things like Diet Coke though is like, in the fitness industry, it's one of those hard to address substances, right? Because you're like, does aspartame
Yeah,
potentially cause cancer? It's hard to know. It's definitely not better than water. But if it's giving you no calories and keeps you from drinking Coke,
that's what I
it
always
is
preach.
better.
It
It's
is so much
weird. It's
better.
so weird because again, it's not gonna give you diabetes.
But
Like,
do you see why talking about all this stuff everybody gets offended because they all you can't talk about it because what you just said just offended probably your entire audience, and then now they're gonna in fitness and they're like, but you know what? You drank those, it's so bad for you. I'm just going to drink the real sugary drink and have the calories and stay fat or overweight and go ahead and go through the drive-through and have a number 4 Big Bacon Classic instead and eat all that. I'm just like,
I,
what's the lesser of the I mean, God. See,
I
we can't talk about it.
we can though talk about it, bro. That's what I'm trying to actually suss down on. Is like you can make that choice. Like, I mean, it is the beauty of America at the very least, right? At least you're not being told what soda you can drink. But I would say in general, like, what's your point? If you said to me, "Hey, well, you're drinking that artificial sweetener thing, I'm gonna go to this." I'm like, okay, like, are you arguing your preference, or are you arguing you want to have the fact-based argument about what's
Yeah.
worse for you?
Well, it's
Because
a
it is
great
true.
yeah.
Medicine has accepted that largely. Again, if you have that corn syrup based stuff, that there's just nothing worse. It's just not good for you.
Well, it's the weight loss tool though. It's a good weight loss tool if you're having
Right.
0 calorie versus drinking 6 real Dr. Peppers a day when
Again,
you're
what
wanting to
works
lose
for you,
weight.
right? I
Exactly.
can't not have something to replace that soda that I used to. I had way too much soda as a kid, and it's not my parents' fault. I'm just I like soda. But I don't drink regular soda almost ever anymore. But it's still like my way of like getting mild amounts of caffeine throughout the day. I like the bubbles. I don't like water that much. So
Would you
the
say
way I get my water intake is through like um, low sugar based sports drinks like G2, things like that. Okay, final one, caffeine and food. This is the good one. All right. In your caffeinated water, a vitamin water energy is 50. I guess you can have 6 of those. In your Red Bull is only 80. But somehow in a Starbucks triple shot, there's 225. In our favorite, Andrew, I deny ever drinking these. A Bang Energy.
oh, my favorite. Don't you
That's
dare.
it. You
Don't take
hit
it
you
from me.
hit the bingo card there. 300. You can't have a single milligram more caffeine.
Well, good thing
And well, what if you decided when you got home and you were pregnant that you needed some Ben and Jerry's coffee toffee bar crunch ice?
man, they love that Ben and
There's
Jerry's.
49 milligrams of caffeine in that.
Yep. You got to watch out, ladies. That's all I'm saying.
Bro, what's your favorite on there? Actually, that Haagen Dazs coffee ice cream is
To be honest
legit.
with you, dude, I don't eat ice cream. I don't eat ice cream.
I try never to because I'm like, what is this heavenly food? Every time I eat it ever again, it doesn't make you feel good after, but dude, it's sugar and dairy and. Uh,
I'll be on the
oh,
toilet for
you
like
see
a
the
whole
Hershey's
day.
there though? Hershey's, you gotta
Yeah.
remember, chocolate has caffeine. Just so you.
Yeah. I love it.
All right, and then the preview into where we're going in the next episode.
Woo.
I think this is the big final. I don't know. I wouldn't say finale, but this is what we're all leading up to with pregnancy is nutrition. Because again, Andrew's going to start us. He's going to start his diet delivery home pregnancy woman meal plan and tell you guys all about how to get the right things in different meals and examples.
Yeah, I'm gonna try to do it because you're probably not gonna, you're gonna interject and say, "Can't do that."
No, bro. You've heard the hard and fast rules. I'll get a taboo buzzer, and as you start, can't say that.
Can't say
His
that one.
name rhymes with Schwarzenegger.
I love the Office references.
Okay. Bro, my office is Office references all day long. Do you know this one? You've been meatballed?
Yes.
Bro, I couldn't stop laughing a few days ago in the office when that one got brought up. Old Stanley and his meatballs.
Yeah,
Okay,
and we're gonna
so
hit that.
on the screen, I am sharing with you what is a recommended screening tool for pregnant patients at one of their initial prenatal appointments. This is theory craft. This is never what an OB has the time to do with patients. And again, is welcome to American healthcare system. We wish we could do this stuff better, but we don't. But this is something that I think is very insightful and helpful for people to look at, which is you look through these questions, and I'm gonna let you try to guess whether it's the left side or the right side that's gonna make you in a bad category.
Left.
Left is a bad category, 0 points. So how many times a week do you eat fast food meals or snacks?
Oh, right. I didn't see that one.
Yeah. So there is a gradation to it, but like it's scored after you answer all of these questions. And if you're getting close to 16, like we have a lot of potential for improvement, basically. So I would just say in general, it's kind of something to like look at here as we have it shared up here. And it helps bore down on it, because I think, like, you know very well, people are in denial about I'm pretty healthy, don't eat this. That's why I always ask people, what'd you eat in the last 24 hours? What'd you eat at breakfast? What'd you eat at lunch? You can't sit there and like it even if they try to sugarcoat it, it's harder for them to suddenly not have a realization that like, oh shit, maybe I am fooling myself right now about how good I am about this stuff. Because how many times a week do you eat fast food meals or snacks? I mean, 4 more times is the worst one. That's less than 1 day a week, or what, less than 1 time a day a week, right? Like, you're doing it every other day and you're the worst.
Yeah, it's pretty bad.
So like you really have to realize that, like, I mean, how much margarine, butter, or meat fat do you use to season vegetables? That one is, I don't know if that one's super relevant to me down at the bottom, but it helps people have to answer hard questions where they realize, shit, if I'm having only 2 servings of vegetables a day, that's not enough. And God knows in Abilene, most people are not having 2 servings of vegetables a day. Like, I know it, unless it's okra and it's fried and it came from Chicken Eat.
From Catfish Corner, baby, with that catfish.
Get out of here with that Catfish Corner stuff. That's not real seafood.
So I guess that's what we're talking about next week.
We were talking about diet, man.
Let's do it.
I'm not going to be post-call, and I am going to be just ready to reinvent the wheel, to glean the cube, to go into, dude, I got some really interesting nutrients and recommendations on stuff people don't ever talk about that are actually very relevant, like choline. Look it up.
Choline. Yeah. C8 risotto. Or this is Muscles and Malpractice.
We got some good stuff, bro.
It's your weekly dose of fitness, health, and everything in between.
What's in between?
The chest muscles. Looking forward to it.
I am too, bro. Go Cougs.
Go Cougs. Hopefully they win tomorrow night.
Dude. They will.
Hopefully they do, so you can win a lot of money.
Hakeem the Dream Olajuwon, my childhood sports star.
Too bad he's not playing, because he's not.
Back to back.
Sorry, dude. You're not playing.
Clyde the Glide will be there.
Crier from Baylor University. Houston Cougars.
he's where
It's all right, dude. A
destined to be.
Baylor Bear's gonna win another title. You'll be all right, though.
Bro.
Sorry, dude. I gotta go. I gotta get out of
All
here.
right. Well, go Cougs.
Go Cougs.
Whatever they do. Okay. And I'll see you after I've called that for the last month now.
Love it. Thank you
Y'all
guys
take
for
care
joining.
of yourself. Bye, guys.